Welcome back, dental assistants, to Lecture 14, Orthodontics. This dental specialty focuses on the growth and development of the dentition and its surrounding anatomical structures. This specialty deals with the prevention and correction of dental and oral deviations. Orthodontists limit their practice to the correction of malocclusion and straightening of teeth. Now let's discuss some genetic malformations that cause people to need the help of an orthodontist. Jaw and teeth discrepancies, facial and palatal clefts, large or small tongue, development and muscles of the frenum systemic. There are also systemic influences, such as infectious diseases, endocrine disturbances, and nutritional disturbances that do play a role in how the teeth develop and function. For instance, a high fever during development can affect the tooth bud formation, causing malformed teeth. Some local oral problems include early or delayed loss of deciduous teeth, the early eruption of permanent teeth, the early loss of permanent teeth, periodontal problems, cysts and intraoral growths, and injuries and trauma. Often, parents seek help of orthodontists due to the habits of their children, such as thumb sucking and tongue thrusting. These are habits that influence the dentition development. Thumb sucking prior to the age of 5 usually presents with no permanent defects, but after the age of 5, there can be defects of the palate, maxillary arch, and the anterior teeth. Tongue thrusting is pressure on the patient's maxillary anterior teeth each time the patient swallows. Bruxism is the involuntary grinding or clenching that sometimes children have, and mouth breathing, which can cause a facial distortion due to narrowing of the dental arches. Occlusion and malocclusion. The entire form and function of the face and its structures are directly affected by the manner in which the biting surfaces occlude or come together. The development of occlusion is an ever-changing process that continues throughout life. In ideal occlusion, the maxillary teeth are in maximum contact with the mandibular teeth. When in maximum contact, there is a 2 mm overlap of the maxillary anterior teeth over the mandibular anterior teeth. Maxillary posterior teeth are one cusp buccal to the mandibular posterior teeth. Centric occlusion is the maxillary and mandibular jaws are closed and the teeth are in maximum contact. Malocclusion is any deviation from the normal pattern of occlusion, and it can severely impair the way we chew our food. It makes us more susceptible to caries and dental decay. It can also increase the incidence of periodontal disease. It can lead to early tooth loss and can cause abnormal respiratory habits. It can affect self-confidence in relation to facial aesthetics, and it can also impair speech. Some malocclusion conditions that you should know are overjet, the horizontal distance that exists due to the protrusion of the most anterior maxillary incisors, the facial aspect of the most anterior mandibular incisors. Overbite, a greater than normal vertical overlap between the incisal edges of the maxillary central incisors and mandibular incisors. A normal overbite exists when the maxillary incisors overlap to the incisal third of the mandibular incisors. Open bite, there is no overlap. Rather, there is an open space between the incisal edges of the maxillary and mandibular incisors, while the posterior teeth are completely in occlusion. A crossbite occurs when the maxillary anterior teeth and or the posterior buccal cusps are in lingual version, meaning towards the lingual side, and do not overlap with the mandibular teeth.